morning, everyone. Welcome. Welcome to all of you who are new to this webinar series, and welcome to all of you who are returning with us, who've been with us before. We have a few changes in housekeeping, so just wanted to make a note of that, but I'm so glad you're all here with us today on this end of January webinar. But so pleased that you can be joining us for this discussion on the national opioid crisis, current trends and solutions, because we're really going to get a nice snapshot of what's happening across the country. Today's webinar is designated for one AMA PRA Category 1 credit, one ANCC contact hour, one ACPE contact hour, one AAPA Category 1 CME credit, and one ADA CERP continuing education credit by the American Academy of CME Inc. For any pharmacists claiming credit, please note that your credit will be uploaded to CPE Monitor within 30 days. This webinar has been approved by NJOEMS for one EMT elective CEU. The Partnership for a Drug-Free New Jersey is also approved by the Board of Certification, Inc. to provide continuing education to athletic trainers. And this program is eligible for a maximum of one Category A, one Category A hour or continuing education unit. PA Planner Dean Barone discloses that he serves on the Speakers Bureaus of Ethicon and Johnson & Johnson, but all other planners, faculty, and reviewers have no relevant financial relationships to disclose, and all relevant financial relationships have been mitigated. Now, if you wish to claim CME or CE credit, you must do so within 30 days from today's date. After that, we will no longer be able to issue credit for today's webinar. So just a reminder, if you wish to claim CME, CE credit, you must do so within 30 days from today's date. Today's webinar is jointly provided by the Partnership for a Drug-Free New Jersey and the New Jersey Academy of CME Inc. and is being held in collaboration with NJ Cares, the Office of Alternative and Community Responses, the New Jersey Office of the Attorney General, and the Opioid Education Foundation of America. And I thank them all for their partnership, support, and collaboration on today's learning series and throughout this year-long learning series that we're kicking off. I'm so pleased to welcome today's expert faculty. I just want to make a note that unfortunately our scheduled speaker, Drug Enforcement Administration Special Agent in Charge Cheryl Ortiz, was called into an emergency meeting and is not able to be with us today. Instead, we have Jennifer Austin, Field Intelligence Manager, who is here today. Jennifer and I have worked together in the past, and I've seen her presentation, which is informative and is going to be giving us all the information and that we need. So Jennifer, thanks so much for joining us and for being here today.
Thank you so very much for having me. I'm honored to be here today as your speaker for your webinar series. As I was introduced, my name is Jennifer Austin. I'm with the DEA here in New Jersey. A little bit about myself. I've been with the DEA, I'm going on 27 years. I've worked both in the New York office and in the New Jersey office. And as such, this area is near and dear to my heart. And obviously, with us being a single mission agency of the opioid crisis is my passion. So I'm going to talk a little bit today about where we are on trends and solutions regarding the opioid crisis. A little bit about DEA. We are a single mission agency. Unlike all of our other federal counterparts that have multiple missions, we focus solely on narcotics crimes. We are made up of special agents, diversion investigators, and intelligence research specialists, such as myself, as well as chemists. Our special agent in charge is Cheryl Ortiz. And our primary function is law enforcement. So a little bit about the evolution of narcotics distribution to explain how the trends are moving. So back in the 80s, 90s, early 2000s, even drug deals had to be conducted on the street. You had to have a user approach a dealer for hand-to-hand. In that sense, law enforcement can knows the locations, can do surveillance, and identify the situation. Then it moved to cell phones. in early 2000, everyone had a cell phone. You can now call and coordinate where you're going to meet. It was no longer just as simple as knowing the spot that everyone had to go to. So technology elevated, law enforcement had to elevate in order to identify where the dealers were located. And now you can sit on your couch and you can order your drugs, receive your drugs, and pay for your drugs. Um, Elevating even more the challenges for law enforcement in combating drug distribution. Um, Talking about opioids, heroin is an opioid. That is an organic. You have to have a growing season. You need pesticides. You need hectares of land. You need individuals to do the farming. And then you also have challenges regarding weather, challenges regarding law enforcement with eradication. So as synthetics came on the market, um, that can be grown, um, created in a lab, we started to see labs pop up. They started to be crude labs, as you see here, even labs in the jungle that are not even in a building, just with a tarp over their heads in 17. And then we move on to where we are today, where we are dealing with pill presses in small locations indoors. So if you think about the trajectory of where we're going from organics to synthetics, there's several reasons why organizations would prefer the synthetics. I've already talked about the challenges that go into growing an organic, right? So you have the farming, you have the cost, you have the security, and then you have the intangibles that you have to deal with, the pesticides, the insects, and eradication and weather. When you're dealing with synthetics, you can have a very small area indoors, easily secured, fewer people. So all of those costs are limited. You also are dealing with precursor chemicals. So in anything else, you can price it out and get the best deal and negotiate pricing. So the financial aspects of synthetics is one of the main reasons why drug trafficking organizations have moved in this direction. In addition, pills lack the stigma that powder has. And so new users um, and, uh, and other existing users are more likely to take pills. Now I'm going to bring you to what we have here today, is labs in people's homes. So this is a methamphetamine lab, but it looks the same as a fentanyl lab. Okay. So what you have is kilograms of powder comes into the New Jersey area. Then you have these labs, these local labs that take those kilogram quantities and put them into street level dosage units. Now, if you think about measuring, right, and you think about recipes, these individuals are not chemists. They're not trained chemists. They're learning how to do this from videos online. So picture yourself doing a do it yourself DIY project of the weekend, whether you're trying to do some plumbing or whether you're putting in some flooring or whatever you're doing. You get on YouTube and you download a video. Is what you do as good as what the professionals are going to do? No. It's the same situation here. It's these individuals follow the videos and put out something that someone is going to consume. The difference is that they're putting out something that can kill you, right? If it's done wrong, if it's incorrectly. This is not a pharmaceutical grade operation where every pill is going to be the same. This brings us to our DEA's PSA, which I'm going to talk about later, which is one pill can kill. So imagine someone in this environment is taking a kilo and turning them into various pills in their mill. Uh, I'm going to use an analogy of making a chocolate chip cookie. So you have one recipe for a chocolate chip cookie, and then you give it out to 10 different people. Is everyone's end result going to be the same? No, because some people are better cooks than other cooks. Some people follow a recipe better than other people. So in that sense, there's no continuity, there's no quality control. In addition, just within one batch, when you mix in the chocolate chips and you make each cookie, does each cookie have the same number of chocolate chips? No. Does the chocolate chips within an individual cookie, are they evenly distributed? No. So that's how fentanyl works, right? It is not evenly distributed throughout a pill. Each pill does not have the same amount of fentanyl in it. And hence the one pill can kill. There's too numerous numbers of examples to give you, but there are individuals grab 10 pills from a dealer, they share them with their friends, 2 people die, 8 people don't, right? Because 2 of the pills had lethal dosages. Um, or you have a set of friends that take one pill and they split it. One person takes a half, the other person takes the other half, one person dies because of the distribution of the fentanyl is not even. Hence our PSA, one pill can kill. Again, I'll get a little bit more into that. Um, I talked about this a little bit. Everything now is online, right? You can order your drugs online, you can receive them online, and you can pay for them online. So a lot of people use the term cybercrime. Narcotics is not a cyber crime. Narcotics is a cyber enabled crime because it has to be consumed. A cyber crime, by definition, starts on the web and ends on the web. Because at some point there is a tangible item that is being consumed by somebody, narcotics distribution is considered a cyber enabled crime. And that's the difference. So we have all of these various sites, apps that people can exploit in order to market and sell and buy their drugs, which all causes challenges to law enforcement. There's virtual currency that people are using in addition to regular fiats, the US dollar and other currency. The virtual currency people like to use because they have a under, a misunderstanding that it is completely anonymous. It is not anonymous. Um, it it can be tracked with virtual currency. Um, it is a challenge for law enforcement, just like anything else. As technology advances, we have to advance our techniques in order to complete our investigations and have successful investigations. Um, here's what's happening today, right? With using social media for marketing purposes. You can see it on Snapchat, you can see it on Facebook Marketplace, you can see it on YouTube, you can see it on Instagram, any and all social media marketing platforms. Is people would have accounts which you could then search through key terms or through emojis, and it will pop up, and you'll find the retailers, right? Um, they have full conversations through emojis as to what people are going to be able to sell and purchase. So there's an understanding of what the various emojis mean, and an unofficial dictionary if you want to use it as that well. So when we talk a little bit about drug trends, I'm going to talk about what we're seeing over time and what we're seeing today. On average today, there are 265 people dying of drug overdoses. Now, imagine this morning, we all woke up to the news of the unfortunate plane crashing with a helicopter in DC, right? Everyone is looking at it. How can it be prevented? What's going to happen? And you can assume that some safety measure is going to be enacted so that this tragedy can never happen again. That's what's happening on a daily basis regarding drug overdose deaths. The 265 people is roughly the same number of seats as on a Boeing 757. Okay. And if we woke up every morning to the news showing that a Boeing 757 crashed and all of the souls on board had died, how would the media portray that? What would be the narrative in the public consciousness regarding what's happening? That's what we're doing, right? And yet the narrative does not mirror that what would happen if it was a singular tragic event. So I like to use that analogy on a regular basis because um, it is very powerful to think that an entire airplane full of people is dying every day of drug overdoses. It is going down. Um, I believe the average based on the CDC is about 13% decline. And um, nationwide, New Jersey is doing very well. We have about a 30% decline in our overdose deaths over last year, which is amazing. A lot of that has to do with the availability of naloxone. A lot of that has to do with individuals working in harm reduction and in prevention and in treatment. A lot of that has to do with programs such as ours with the PSA of getting the awareness out there of how dangerous opioids are. And because of that, individuals who have yet or who are not um, consuming narcotics are either staying away or unfortunately some of them are going towards stimulants, which is a trend that I'm going to talk to you about in a little bit, that they're going towards stimulants as well as instead of going towards the opioids, which they are aware that will kill you. In addition, the the dosages are becoming less fatal. So there is um, a lower amount of fentanyl in each dosage, and that is intentional because of the increased law enforcement presence and um, priority on going after the drug cartels and going after the mills in Mexico and the super labs. Um, they don't like the pressure, and so they're let's do everything we can to make less lethal dosages so that the pressure from law enforcement will let up. Right? They're like, people don't care about the overdoses so much, they don't like everyone dying, which those of us on this call obviously care about all of the overdoses, but from the concepts of the cartels and the drug distribution organizations, that's their thought process. So they're making dosage units that are less fatal. And so that contributes to the decline in the overdoses, fatal overdoses. But it is noted, and I will say it again, that there's fentanyl has permeated our entire drug environment, whether it's a synthetic, whether it's a stimulant, whether it's an opioid, whether it's an organic. It has permeated the entire drug environment. You will find fentanyl in everything that is tested in the labs. Speaking of, I have this slide up here. DEA alone, not even including our federal partners, seized enough fentanyl last year to kill every single American. And that is a scary number because we are not seizing even half of what is coming into the country. So the amount that is coming into this country is staggering, and we have to keep our foot on the gas and keep moving forward. Um, it is amazing that the numbers are going down for fatal overdose deaths, but the number of overdoses is still there, and the number of people who need assistance is still there. Um, Highlighting the decline in New Jersey, here we are at 31%. It's quite impressive, I have to say. Um, that is due not in a small part to the New Jersey State Police utilizing ODMAP to track and identify locations of overdoses, both fatal and non-fatal, and working with the local community to combat that. Another thing to note is fake pills, right? And we use the term fake pills, right? Words matter. And fake is not counterfeit. Fake is not knockoff. Fake is not generic, right? Fake is fake. You know it's not real. So we want to make sure that when we're trying to get our messaging out there to the public, that they understand that these pills have nothing in common with the legitimate pharmaceutical, right? We want to make sure that they're not saying counterfeit, and then therefore it's sort of like, it's the same thing, but it doesn't have the name brand on it, right? Um, so fake has a different connotation. And so words matter. And that's why we have moved away from counterfeit pills to fake pills. These are some examples of the fake next to the authentic. And it's really hard to tell. In fact, sometimes the fakes look better than the authentics. So that is what we are up against, right? The pill presses that are being purchased to make these pills are good, and they're churning out very legitimate looking pills. Um, but you can look and see the M's are a little different. You can see the font on the 30s are a little different on the numbers, the depth and the width. But unless you actually have it next to a regular one, you're not really going to notice. So these are just some examples of what you can get and what you can't get. So the next thing I want to stress is that there is no such thing as a legitimate online pharmacy. The brick and mortar pharmacies might have websites, but you can't order your prescriptions from them. You still need a prescription, a physical prescription that is either sent from a doctor electronically or a piece of paper that you drop off with the pharmacist. So people going online to open web, sorry about that, open web sites, clear websites, and ordering pills, those are not legitimate pharmacies. And unfortunately, individuals think they are, or they're under the impression that they're getting knockoff drugs, right? Drugs that quote unquote fall off the back of the bus, right? That's what people are always thinking, that somebody has diverted these drugs. That's not the case. They're meant to look like it, but there's nothing inside of the pill or inside of the capsule that resembles the natural drug. It is most of the time, if we're talking about synthetics, it's most of the time meth. And when we're talking about opioids like oxycodone, it's going to be fentanyl primarily. This is a graphic showing that we are tracking the pills, the dosage units, and that there are fewer of them that are lethal, which I just discussed before. that the the lethality of the drugs is declining, which is also contributing to the decrease in our overdose deaths. Just in 1 year, we've gone down from 7 of 10 pills to 5 of 10 pills contain a lethal dose. So let's talk a little bit about how drugs get to New Jersey, right? The precursors, the chemicals, primarily coming from China. They're going into Mexico for them to put into labs that we discussed, the evolution of the labs. They're making the fentanyl, they're bringing it into the United States. And then it comes into Jersey to be made into dosage units and then delivered. And then the money is laundered back to Mexico and China through a number of means. The drugs get here a number of ways. They're either brought up in vehicles, tractor trailers, or personal cars through the highway system, either from California or from Texas, most of them coming cross country directly, or across the southwest border, the Gulf of Mexico, and up through the East Coast. There's a number of interdiction states stopping in most of the major cities on its way to Jersey. So fentanyl in New Jersey. I've already mentioned that it has permeated every drug within our drug environment. It is marketed to be fun. This is birthday cake is the photo on the bottom that looks like chunks of crayon. It is fentanyl powder. And it's sold in this amount in these packages for people to then take the powder and make into pills or make into the glassine bags that are sold on the street. And then you have the pills. Now you'll notice these pills are multicolored. They are all on the same stamp. So they are all the M30 fake oxy stamp, but they're not even trying to pretend that they are fake oxys. They're just putting them out there in any color because colors are fun and people want to have fun when they take their drugs. So it's just a marketing campaign. We are also seeing in New Jersey carfentanil. Carfentanil is 100 times more powerful than fentanyl. It's an analog. We don't see it often. It is pretty stable, it's consistent. We've had it for a number of years. It flares up every once in a while in a particular mill that we seize, right? So I wouldn't consider it a trend that we're getting more of it, but it's definitely something that's around that you should be aware that some pills that are out there are more deadly than others because they're using the analog carfentanil as opposed to the base fentanyl. We're also seeing nitazines and their analogs within our drug supply, and that is increasing. Again, it has to do with the drug trafficking organizations trying to change what they're putting into the dosage units. Except for nitazines can be more powerful, more lethal than fentanyl. Some of them are, some of them aren't. It just depends on which one it is. We have seen these 4 different nitazines in the New Jersey environment. Primarily, proton nitazine is the primary one that we've been seeing in New Jersey's drug environment. Xylazine. Most of you have heard of xylazine, especially those of us in New Jersey, regarding Kensington in Philadelphia. Xylazine is a tranquilizer for horses, and they have started putting it into our opioids, our fentanyl and heroin dosage units to extend the high, right? So um, from the street term is it gives the high legs. Okay, so it extends the high. What's dangerous about it is that it's not lethal, right? So that's another reason why they're putting it in, because they are not negatively affecting the high. The user still likes it, but they're taking out the risk of death. Um, but what xylazine does is it puts them in a trance-like state. Some people call them zombies, where they're just on the edge of consciousness. So it causes a public safety risk because the user cannot respond to anything. So they are subject to the weather. If they're outside, they're subject to animals. They're subject to physical violence when they're in this state. Xylazine also, what it is it restricts your veins. So it's a vasorestrictor. So it doesn't let oxygen go through. And so in certain cases, it's in certain individuals are more susceptible to it, sensitive to it than others. And the veins on their extremities are not bringing the oxygen. And so therefore their skin is dying. It's necrosis of the skin, which causes wounds that do not heal. Um, in other cases, because it is also restricts your breathing because it is a tranquilizer, right? It slows your breathing down. Individuals who have breathing problems such as asthma are more susceptible to having asthma attacks and those symptoms when they are consuming xylazine. So why they might not be overdosing from the fentanyl, they might end up having um, uh, situation with lack of oxygen, and so therefore have any negative effects in that sense. We have trained first responders to not only give them Narcan, but give them oxygen as well. TUSI. TUSI became known to the public over the summer when a, a band member of One Direction died of it in Brazil. And TUSI is known as pink cocaine because it's a stimulant and it's pink. It's a party drug. Um, it came on the scene in the 1970s with an entirely different toxicology um, in Colombia. And so what happened was they have kept TUSI, but they have changed how they make it. But for marketing purposes, it keeps the name. And it's a mixture of ketamine is the primary, another veterinary medicine with MDMA or cocaine, various other stimulants. And we're seeing an increase in TUSI use within the club scene, the party scene in New Jersey. Prescription data, we have seen a steady decline, as you see here, with prescriptions being written for opioids, which is good. So that is also on the horizon, which brings us to our diversion program. So our diversion program runs our National Take Back Day, which runs twice a year, so that we can get it out of the pharmacies. Get it out of your medicine cabinets, so that people aren't tempted to try expired drugs, that children aren't tempted to try their parents' pain medicines. So we've run Take Back Day. DEA has run Take Back Day from twice a year. It started actually in New Jersey as Operation Medicine Cabinet, which is pretty cool, with the Partnership for Drug-Free New Jersey. So we have been partnering and collaborating with the Partnership for Drug-Free New Jersey for a very long time, and we are very proud of what we have been able to accomplish through our partnership. And these are just the numbers from our fall take back. So we are collecting 13,000 pounds of unused prescription drugs. And that is a wonderful number. And then what brings us to our outreach and prevention piece. So the youth synthetic opioid involved deaths. This is always a scary number. I don't like it when we talk about our young people and drug use. Um, there is a 91% increase nationwide between 2018 and 2023 in individuals under 25 dying of drug use. That is not an okay number. Um, New Jersey is doing very well. New Jersey has declined 44% in that time frame, but just because New Jersey's doing great, we need to figure out how to get the rest of the country there. Um, and so outreach to the schools is so important. Outreach to the community. Here's an example of what we have done from DEA for our PSA, One Pill Can Kill. On the right, you'll see a sign at a baggage claim that is from Newark Airport. We had that up for several months at Newark Airport for everyone to see, and the billboards. And there's a QR code if you would like to get more information on One Pill Can Kill. We also have a number of other resources, publications, operation prevention websites, things of that nature. We have accredited curriculum for elementary, middle school, and high school health classrooms to go in and teach our youth about the dangers of drugs, getting to them before they start, because prevention is the key. In elementary school and middle school, before they get into high school and know more than they're adults. For those of us who have teenage children or can understand what they know. What do we know, right? We're just the parents. We're just the adults. So to getting to them before when they still listen to us is very important for our educators and caregivers. So there is information for that. We also go out for Red Ribbon Week in October to the schools here in New Jersey to give presentations ourselves for assemblies and things of that nature. So that brings me to the end of my presentation. Does anyone have any questions?
So thanks so much, Jennifer. Really comprehensive presentation. And I think I know we do have some questions before we get to them. I do want to mention because I saw in the chat after you mentioned our collaboration that goes back previous even to 2009, right? But in 2009, when we launched Operation Medicine Cabinet, which became the Take Back Day. We've been doing wonderful things and getting those messages out, and some of those messages were referenced. I saw someone in the chat mention the "Who Knew Grandma Kept a Stash" campaign, which I know was all over your building as well for many years. So it is important, right? We know that the messaging is important, and you shared some of the messaging as well that you have out there in around the region, and I'm assuming nationally there's messaging campaigns that go on as well. But can you speak to all of those in attendance, right? We have prescribers who are dealing with patients every day and have people in their waiting rooms, or we have people who are, in the prevention and the treatment fields, and in law enforcement and social workers, educators, nurses, everyone, on with what can they do to help get some of that awareness and messaging out that you talked about being so important in helping you do your job?
So I think that the biggest message we need to get out there is that the online pharmacies are not selling real drugs, right? So um, people are like, I'm not going to a drug dealer. I'm getting this off the internet. I'm like, well, do you know who's running that site, right? So, so that's a big message. the scariest thing for me, so I have kids in college, right? And the scariest thing for me is the fake Adderall. So when I was in college, we went and we went through a pot of coffee, right? When we were cramming for finals and doing all nighters. Maybe Mountain Dew. Some people, were into the caffeine drinks, but now they're popping pills, right? Um, so it's scary for me that where are these kids, and to them it's second nature to order something from Instagram, right? Or I shouldn't even say Instagram because that's not what they're using. They're Snapchat, right? So the it's just second nature to do it that way, and it's second nature to have a conversation using emojis, right? Those of us who did not grow up using phones, right? Um, and it's not natural for me to speak in emojis. I still text in full sentences, to much the chagrin of my children. So it's that we need to that messaging that we need to get out to our young adults.
No, I think that's so important. At the end of 2024, the Partnership for a Drug Free New Jersey conducted a study with Fairleigh Dickinson University Public Mind Poll to see if parents understood about those online sites where people or children were accessing those fake drugs. And I do like that change in words from counterfeit to fake. I think that's great. And unfortunately, a lot of parents didn't. So what would your message be to them, to the parents? I know you talked a little bit about the dangers of the fake drugs, but
So for the parents, I would talk about um, don't shy away from the conversation, right? Have the conversation. There's not a kid out there who doesn't know someone who's used a pill, who's used something, right? Or who knows of someone who does it. So um, we have to get out of our comfort zone and talk to our children about the dangers of drugs, right? We have to talk to them about the dangers of using someone's pill, right? Oh, it's we didn't get it online. The doctor prescribed it. Do you really know the doctor prescribed it? Okay, so it's in one of those little pill jars, but where did it really come from? And to that extent, you shouldn't be using someone else's medicine, right? If a doctor has to prescribe it for somebody, then it's for that person. Everyone's chemical makeup is different. I use the example with my kids is that some people, take Tylenol and it takes care of a headache. Tylenol doesn't work for everybody. That's why you have Advil, right? And some people, they take 2 Advil and they're fine. Other people need to take 3. So, so we don't all work the same with the same drugs. So you can't just take something that was prescribed to somebody else, assuming that it's going to work the same for you.
no, that's so true. And we know, obviously, you talked about the trends of youth and we're now, what parents need to know. But and you talked a lot about what we're seeing or what's happening in New Jersey or in the New York, New Jersey region. But can you speak to some national trends that we should be aware of? I know I saw someone shout out from Massachusetts. I saw someone shout out from Kentucky, who's on with us today. Just in general, nationally, are we seeing the same things? And also, are we unique, right, as a country, or are there certain regions that are unique, or is this something that we're seeing as well outside the country?
So nationally, the trend is towards stimulants. We're really moving to cocaine is increasing significantly. Methamphetamine is increasing significantly. Um, so uh, the methamphetamine, a symptom, is hyper, extreme hyperness. Uh, and you would be able to note in your children, in your friends, in your family, um, methamphetamine use, just by simply saying, "Whoa, did you have a lot of coffee today? Like, what's going on?" It's like, no, 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 no. It's one of those types of things. So pay attention to that more so than actual cocaine use. Methamphetamine is they become little ping pongs. Another thing for our dentists out there, I don't know if you have any dentists. Um, Dentists tend to be the first people who see drug use. I'm not sure what the biological reason for that is, but the use, your teeth, your gums are affected um, quite dramatically by methamphetamine and by other stimulants and things of that nature. So so that's something that that they can be aware of. Um, or as a parent, you know, all of a sudden, if your kids are having gum problems or they're having a lot of cavities that's abnormal for them, um, that might be, you know, a red flag. Um, but that's basically the move to stimulants. I talked about the increase in 2C, which is a party drug, right? Um, and so we've moved away from people popping fake M30s to people popping fake meth pills. Okay, what it is, they're popping pills that are made out of meth and ketamine. So what's interesting is the increase in use of veterinary medicines. So there's a wide range of sedatives, right? So even for us, right? That what you would take for a headache versus what you would take to have surgery, right? There's a wide range of what sedatives have. So xylazine is a tranquilizer for a horse so that a horse can have surgery, right? I'm not the size of a horse. I do not want it in my body. Um, Ketamine is more of a anesthetic for just taking the uh, it's much lighter, right? It's for calming the animal down so that they can work on them, right? It's in the middle of what getting rid of a headache versus putting someone to sleep. So the use of ketamine in our party drugs in 2C, um, it also creates a hallucinogenic effect, right? And hallucinations can always lead to bad things, not just from the overdose, but also your actions that result in that overdose, which is what ended up happening to the unfortunate individual in Brazil who passed away. He was having really bad hallucinations and destroying his hotel room, and then jumped off the balcony because of his hallucinations.
Yeah, that's was such a difficult story and really impacted multiple generations, right? So it was a tragedy and sad, but an opportunity to have these discussions, right? And to talk about these things and to raise awareness. Before I go to the next question for you, I just want to make note first, Arkansas and Texas. Saw you in there, so thanks for that shout out. There's some information on the screen about how to get your continuing education credits. Want to make note of that. Remember, 30 days to get that. Also, a copy of the presentation slides will be made available to you, as well as a recording of today's presentation. So just wanted to make note to that. But Jennifer, jumping back to you, you talked about dentists, and I think that was so significant, right? We know for many of our young people, right? When we talk about opioids, we know dentists are the first time they may be prescribed an opioid. And they talked about with meth mouth and those things. But what, from your perspective, what role in prevention can our prescribers play? A bigger role, I should say, in prevention, education, and awareness.
So it's very important that they are cognizant of when people are asking for more, right? Than is their normal. They know what normal is, right? Because they're dealing with patients all the time who are going through the exact same procedures, right? So when you have someone requesting more, um, also the age of the individual, right? So a brain does not fully develop until 25. Okay. To be very conservative when prescribing opioids for for young athletes specifically, and for anyone under 25, right? So those are some things that I would talk to our prescribers about. Um, and I know that there is messaging out there to write um, prescriptions for fewer dosages, fewer days, and then say, come back to me, I'll renew it. There's a messaging out there not to have refills, right? And so you have to come back and get more. So I'll give you enough for 2 days. I'll give you, and then you have to come back. So it makes it harder on somebody to become addicted because they don't have it right there, right? Um, and addiction is a thing, and most people, don't plan on going down that road. But again, we all have different um, chemical makeups, and some people are more prone to it than others.
No, I think that's so important. And we know, like, for example, here in New Jersey, and we have legislation that requires that at a time an opioid is prescribed, that the prescriber have a conversation with the patient or the patient's parents about the potential for dependence and addiction, and alternatives that exist, right? And a note is made in the medical record. But that's so important to your point about securing the medicines in the home. If you know how dangerous and how potentially addictive they are, right, you'll secure them. And I think that's really significant as we see other states, 20 other states follow New Jersey in that, but other awareness and empowering, right, patients and parents to have those conversations with their prescribers. I think you're right. That's really important. Can you speak to trends across the ages? So from college campuses to our senior citizens, anything we should be aware of or that you're seeing?
So from college campuses, I mentioned the fake Adderall pills, right? That are being used. There's always an increase in overdoses, not fatal, and unfortunately, every once in a while, fatal during finals week, midterms, when people are doing the all nighters. So that's something going on in our college campuses. On and our senior citizens, there's a lot of pain management. The senior citizens forgetting, did I take my pill? Did I not take my pill? And then sometimes they're taking two or three because they couldn't remember they were taking it, right? So there's always a danger to that. And that's what we're seeing when we're seeing overdose deaths from legitimate prescriptions. It's typically user error, I hate to say, because of that. So when I myself was giving a, a presentation in a senior citizen facility, I said, get those little packages that says, AM, PM, Monday, Tuesday, three, like set it up every week. And then you were like, oh, I took it, right? So you don't forget. Um, it's really hard on us as we get older to accept the fact that we can't remember.
Yeah, you're right. And just,
I can
even
speak to
even
that
when you have a
personally.
busy life, right? Not even when I mean, when you're older, but even when you're so busy, you're like, wait, did I take
Yeah,
that? Did I
yeah.
not? What
I,
is the
I,
situation?
I,
So I
I
think
can
that
personally relate. I can,
something,
yeah,
yes. I think many of us can relate to that. Before I go to you just with a final thought, again, I just want to mention to all of our participants, I want to thank you for joining us today. Again, information on obtaining credit is on the screen, and I hope you'll join us next month for our webinar, Preventing Opioid Misuse and Addiction. And we're really going to really try to delve into some community strategies that work and some research that's out there. But before we wrap up, Jennifer, just your final thought for today. One thing that you think is so important that all of our attendees take with them.
well, partnerships like this, developing them and encouraging them and bringing all of us together to speak about this. The more we talk about it, the better it can be. Like we can only move forward together. We can we cannot combat drug use with law enforcement by itself, right? We have to work together hand in hand with harm reduction, with treatment, with awareness campaigns. It has to be everyone holding hands, going forth together in order to deal with this epidemic.
I think that's the perfect note to end on, and also the perfect note to kick off our year of this learning series. I think if we remember that as we learn all of our lessons throughout the year, it will do us all well and hopefully help us to really make a more significant impact. So, Once again, Jennifer, thank you so much for all of your time and efforts today in doing this presentation. I know there are a few questions for you that we weren't able to get to, and we put information in on how to contact Representative Joanna at the DEA, so you should see that in the chat. Once again, thank you, Jennifer. Thank you for all our attendees, and I hope that you can join us next month again as we talk about. Listen, now we know what's out there, right? We know what we're dealing with. How do we prevent it? How do we implement some of those strategies within our communities, within our families? So I hope you'll join us. Wishing everyone a wonderful day. So thank you again.
Thank you so much for having me.
Thanks. Bye bye.